Hello again, everyone. Mark Hackle, Macomb County Executive, Deputy John Paul Rea. Just giving you an update of what's going on here with COVID. Let's just kind of first start off with the numbers and I guess the statistics here in the county as well as statewide. Incredible change in what we're seeing right now. The numbers have really dramatically decreased as far as, obviously test positives as well as deaths percentage of. So we're seeing some good things in here and that from our health department as well. And again, that's available on site, macombgov.org, which you're tuned into right now. It's looking pretty good when it comes to the numbers.
Mark, positivity rate that is in the high 3s, low 4s, and I think what has happened now is, again, that continual engagement with communities, that as we've re-engaged virtually all elements of our economy, as we've brought more kids back to the classroom and everything, we've been able to manage it, we've been able to adapt those environments, and we've been able to ensure that they're as safe as possible for everyone as we are getting back out there and re-engage in so many different elements of society on that end. I think the other thing that is just fantastic too is, again, just the responsiveness with regards to the testing sites that are out there. So individuals know that if there's something wrong or if they're feeling something, they can get that quick response back, whether it's from our test site or the other options that are out there too. So again, that continued management on that end has put everything in an incredibly manageable environment where we're able to respond on that front.
And it's interesting, you talk about the test sites. If you stop and think about, where we've been at in the uncertainty of this whole situation since the onset of last year, beginning of last year, I guess the dramatic nature, I think, of sometimes political personalities who want to, kind of get engaged in some of these conversations and, rather than try to figure out how do we work through some of the solutions to get there. Early on, the big concern was PPE. There wasn't enough. And, people jumping on board, what do we need to do? At first they said, don't wear masks, then wear masks. And now we're at a point where it's far different. Now they're telling you to double mask. So we're hearing so many different things, but masks were the early problem. And now we have an incredible stockpile, probably throughout the entire country. I know we do here in Macomb County. That's no longer the big push. Then early on it was contact tracing. Oh my God, are people going to call if somebody's got a test positive? How do we know? There was a big push to try to figure out how do we do that, and that problem was solved, by many health departments around the state. And so after the contact tracing became testing, like you just got through talking about. How do I get a test? Where do I get a test? There wasn't enough test kits, and the big push on that, and people trying to drive I guess the excitement or the anticipation of this. And so now where we're at, plenty of test sites, plenty of availability, and they're running smooth. They're doing good. Now the big thing is the vaccination and how we're handling that. And I think I'm just going to say it, things were going well, under 1A, when they realized we have limited amounts. And that was the big key, making sure we're not over-promising. And so I've said this time and again, 1A was the responsibility of three basic different entities. One was the pharmacies dealing with congregative care. The other was the hospitals dealing with healthcare workers. And third was health departments across the state trying to take care of those who are licensed EMTs. It was working smooth. And then the script got flipped, and I say that because all of a sudden there was this opening for other categories when we weren't even done with 1A, and now you got everybody fighting to get on the list or try to be a part of, wanting to be part of this 1B when we weren't done with 1A, and I say that specifically because congregative care here throughout the state, not just here in Macomb County, if you will, just kind of taking a look at that, there's still about 6,000 people, obviously residents as well as workers in congregative care that weren't picked up by the pharmacies, and we're trying to figure out how do we pick that up with incredibly limited doses that we have. And yet, people are saying, why can't I be part of it if you're going to let teachers in and police officers? What about people with disabilities? What about people that work in the grocery stores? And, the floodgates were open, and now there's controversy amongst one another as to why is someone more important than I am? How come I shouldn't have a chance to get vaccinated? Why can't I call in or get on a list? And so with that, that fight, and I think we're losing sight of the real data and the science. All those entities or groups, or if you will, organizations that are out there, trying to figure out how they get in, we're losing sight of the fact we haven't finished with 1A, our congregative care. And we haven't really focused on the folks that are most vulnerable when it comes to the data and the science, and that's our seniors. Seniors 60 or over account for 90% of the deaths. And so everybody is fighting to get on a list and trying to get themselves out front of our senior population, and really creating an incredible challenge for health departments and everyone else to try to figure out how do we solve this problem that I think should be more controlled statewide. And everybody's off doing different things around the state right now.
So Mark, you illustrate the fact that, as you said, there are so many different systems that are being orchestrated, whether by a singular county, as we do with our Tuesday calls, you know, the other 82 counties across the state. Each one has their own iteration of how they're signing people up or moving people on a priority list or highlighting, you know, a different clinical
And
type
some are not even doing that.
Yeah, and some are not. Some are just telling folks, hey, good luck getting it from a private entity or agency.
And some of them are larger counties.
Exactly. So then you layer in the whole notion with regards to each one of the healthcare systems is doing their own thing, trying to figure out how they service the priority groups, but also their patient groups and everything too. I think the fascinating thing about what we have done, and I think the other thing, as you said, just more or less the credibility that our emergency operations team has built up throughout this entire COVID response is whatever challenge has been there, we have developed a community-driven solution. So this conversation about where we're heading next, we're just not sitting back with our feet up on the table and just saying, these are all the doses that we've got. Every single week that we have had this vaccination thing, we have modernized, we've expanded capacities, we've brought in more and more partners, whether it was standing up the Verk site that was an underutilized office space that is now a clinical environment where every single person that goes through gives us glowing reviews time and time again. Whether it's bringing in additional partners like Smart to help with those that are transit dependent and have mobility issues. Whether it's expanding the pharmacy options with regards to Myers and the dose allocation that we're partnering with them. This week now too, expanding the capacity with Sterling Heights, deciding to open up the site over at Lakeside. We're going to be testing that and looking at a few doses there. These are things that we're doing day in, day out, and we will continue to modernize and bring solutions to the public to ensure that we can expand capacity. But those solutions will not solve the supply issue that we continually face every single week. When
And that is the bottom line. It's so interesting. We conversation about all these other things we should be doing and how come we're not doing it this way or whatever. The simplest way of putting it is this is interesting. I mean, when you talk about a normal flu season and what we've dealt with in the past, whether we've had other concerns with other viruses, it was about the fact that we were able to manage, a demand side because we had the supply side. That's not here. And so opening it up for incredible demand has created quite a crisis within the crisis, and yet everybody's losing focus of that. They still think that we're going to solve the problem by coming up with a different way of, putting another test site available or another vaccination site. Putting up another vaccination site, once again, waters down the amount of doses that we get, and that's a limited amount to begin with. We ask for 50,000 a week. Again, I remind everybody, we still get 5,000 a week. We could open up sites everywhere in the county. We don't need any help in that regard. We know how to do it. We're ready to do that. We have the staffing to make it happen. We can do specific things for teachers. We can do specific vaccination clinics for people that have disabilities. We could do specific vaccination clinics for police and fire if we had the doses. But right now, it's been open to a certain classification or group of people, by the state, and I have to allow access for all with an incredibly limited amount. And so now, the question is, what is a better system? I look at the state of Missouri, and the state of Missouri, at least they got this right. What they did was they opened up a particular portal that people can go ahead and get in line. They can actually go ahead and sign up for the vaccination statewide and then disseminate it based upon where they're at within the state under one system. We did not do that here in the state. And so by not doing that, it created a problem for everybody to do their own thing, as JP was just mentioning. You got some counties saying, forget it, we're just still sticking with 1A. A lot of people unhappy in that county, but I should get it because I'm a teacher, because I'm a police officer, because what about people with disabilities? And so you got other cities that are deciding, hey, we're gonna open it up and vaccinate people that are security personnel, that are food workers. That's all well and good, but it creates a problem for the rest of us to try to figure out how do we keep up or catch up with that when we can't even take care of those seniors that are most vulnerable. And right now we've been trying to figure out a solution better than our Tuesday call-in. We know that's not the optimal solution either. But with that, we don't want to create a system that's going to create another problem. We know other counties have done a wait list, and they're running into problems where people continuously call their health department complaining because they haven't heard from them in a couple of weeks, they haven't heard in a couple of months as to where they're at on the list and how come that. So now they're inundated with phone calls to try to figure out that. So we've been working on the back end to try to figure out before we leave this new this phone call in or online system with the very few doses we have, what's out there that's more, I guess that could be more conducive to handling this particular situation here. And we've been working, like I say, with Smart. We've been working with Myers. We're trying to figure out a couple other private vendors that are out there. Even Missouri, the system they have, we're looking at. But before we move or migrate to something new, we want to make sure it's not going to cause us another problem. But I got to tell you, we've been promised all along, this should not have even been a problem, that we were going to get more vaccines. And the vaccines would, without question, solve the problem. We don't even have to have a wait list. That's the problem. And so, you know, the worry is by the time that solution comes around, much like we've already seen when it came to PPE, when it came to contact tracing, when it came to testing, this will finally resolve itself, and it will be on to complaining about something else or worried about something else, and you know, public officials will be trying to drive another wedge between other public officials to make it look like they're doing something. So the politicizing of this issue is unnecessary. Unfortunately, it does happen, but I think there's a responsibility on behalf of the media to get out the true story. And the true story is right now, here in Macomb County, we have focused on our seniors. That is the #1 issue. We've been pushing to get 6,000 vaccines as a direct allocation from the state to take care of those congregate care that weren't taken care of under Phase 1A. They're still eligible, obviously, and we can do that. All I need is that 6,000 doses. If I was to take the 6,000 we have right now, what a stir that would create with everybody else who's eligible saying, wait a minute, you can't do that. Well, technically we could, but it's unfortunate the incredible backlash we'd get for people that want to, you know, believe that they should still go to the front of the line because they're allowed to by the state guidelines. And you know, I still just don't understand why our focus and our attention isn't drawn on the congregative care folks and our senior population here, and everybody else just kind of sit tight and wait till we take care of that. Then we move forward and figure out who's more important than the next that isn't based on the data and the science.
So Mark, I think the other thing that's interesting with regards to the conversation about, you know, this whole notion of list or, you know, vaccination management or dose allocation is some of the sentiment with regards to how we're looking at the most vulnerable of populations. The state itemized the social vulnerability index, which comes into the, you know, allocation strategy. Obviously, we have our focus on seniors because it's backed by the data, the science, you know, the mortality rate and everything on that side too. The other thing that I think everyone needs to be in tune to is the fact that we have a tremendous amount of knowledge with regards to any barriers that might be in play around the county as we're distributing this when vaccine and supplies increase. So the assumption out there that we don't have these strategies or plans or things in place couldn't be further from the truth. We've cultivated these relationships. We have our community service providers. We have our epidemiology experts that know where these issues are, whether it's issues with chronic disease or a concentration of other elements from a socioeconomic standpoint or from a demographic standpoint. We have all that knowledge horsepower here in this county. We just don't have the doses to distribute the strategy.
Bottom line.
And when we look at this from a day in, day out perspective of all the individuals that sit in that emergency operations center, from the endless conversations that happen on the public health side, from the multiple conversations we have every single week with leaders all the way up to the governor's office, we are advocating on behalf of this county, and we are doing everything that we can to ensure that these strategies get to those that are most vulnerable and need this vaccine as quickly as humanly possible.
And we say that. I mean,
Yep.
much like we're trying to advocate on behalf of the folks that are part of congregative care to get the doses direct allocation from the state has kind of already opened that door. They've appropriated a direct allocation for Department of Corrections to vaccinate all their Department of Corrections folks. Well, since you were able to make a direct allocation for a particular, you know, occupational group, we're good with that. But let's go back to vulnerability, Phase 1A. Why can't we get that direct allocation, 6,000 specific outside of our normal allocation, to take care of congregative care here in Macomb County? Much like every county should be able to do that. And with that, I even offered it up to the ISD and to the teachers organization or association. See if you can't push for a direct allocation on behalf of the state, and we'll vaccinate all the teachers here in Macomb County. We can do that. We're prepared. We could do it at the VERC site on a couple of weekends and or even at the ISD building. We are prepared to do that. All I need is somebody to get that direct allocation for those groups or those segments of the population, and we'll gladly do it. But I continue to go back to the central issue here is the data, the science, everything else. We talk about vulnerability index. If we're collecting data based upon vulnerability index and determining that's how many doses you're going to get because of language barriers, race issues, income levels, all those other things that come into play, then I guess that should be the target group specific as to who we're giving it to. That's not the case. They're collecting it based upon all of these indexes, and they're still opening it up to folks that are firefighters, police officers, teachers, senior citizens, and the like. As JP mentioned, we know how to target every one of those groups that are within those categories, but if you're going to open it up to teachers, firefighters, police officers, senior citizens, then we should look at the population base that we're trying to target. So in other words, what is the population of Macomb County seniors? What is the population of teachers and firefighters and police officers? And then bring that in, and then make a determination as to how do we get that to those that are most vulnerable in that area. So again, this is so way off, with the state, managing this, and you got others doing things that are outside the state guidelines, would put pressure on many of us. We're trying to figure out how do we help people that have disabilities. We get a lot of outreach and concern about, are we taking care of? They're not on the state's list of people that can be vaccinated. Yet you got other areas making press releases or press conferences saying we're going to vaccinate people with disabilities. The rest of us are sitting here thinking that's outside the state guidelines, but it doesn't seem to have any repercussions on behalf of the state. But we do it, and then all of a sudden you're going to get backlash from teachers groups, firefighters, senior citizens saying, hang on a second, how come you're vaccinating people and you haven't got to us yet? So it's an incredible challenge, and one, I think there needs to be a little bit more direction from the state to be more specific in saying here's how we're going to do this, and continue to move forward in that regard. But in the meantime, it's going to be confusing, it's going to be a lot of tension, and the only thing going to solve this problem, and we say it time and again, give us more doses. Give us 50,000 doses a week, and we can handle it. Or those special interest groups that are out there on behalf of firefighters, teachers, senior citizens. Make an appeal to your state representatives, to the governor's office. We stand with you to do that. As a health department, we can vaccinate the masses. We just need those doses to come our way so we can do what it is you're asking us to do.
Mark, I think we're prepared. I think we're not only ready, but as you said, we not only have had the conversations with those community partners, but we know where our community is at, and we know how to get these doses out as quickly as possible to those that are most vulnerable.
Yeah, so we're going to keep trying to do the best we can of managing through this crisis. We're trying to figure out how do we get away from that Tuesday call-in system. But as I mentioned, that's been a very we're progressing in the right direction. We think we might have a solution, but again, we want to make sure that that solution provides an option to let people know they're on a list, as opposed to leaving them out there in limbo. Just to, do they know that I'm even existing? It's, we've heard other systems that are out there. It's been a month or so, and they haven't heard back, so they don't even know if they're still on a list. We encourage people to get on lists all over, whether it's the Myers list that we have encouraged and we're giving doses for. So in effect, we do have a kind of a semi-list system already in place, aside from the Tuesday call-in. People can still get on that list for Myers and get some kind of a vaccination or doses here in Macomb County. We know what we're doing with SMART to try to take care of our really vulnerable population based upon the data and the science, and it's our seniors, specifically those that have transportation needs. And our health department here, and we see what we're doing at the Verculen building with the leftover doses available there. Unfortunately, there's that call-in process and online process that is a very challenging one for many, and we do hear about that. But in the meantime, we can't switch over to something completely different unless we know it's going to be a benefit to you, the public, as well as something that is going to really take care of scheduling appointments here.
Mark, as you have said, there is no need for us to deploy another solution that's going to create additional problems on the back end. And that's what we have not only been exploring for weeks and weeks now on the technology side, on the integration side, on the public health side, and most importantly, on the user side. Whatever we bring forward, we want to make sure is user-friendly, the expectations are known, and most importantly, the notifications and feedback is always there. Same way as we've done with the video updates, same way as we have done throughout the onset of this pandemic. Be as open, honest, and transparent with the public.
It's a methodical process,
Yep.
One we don't do a knee-jerk reaction to, and some people, have got an opportunity to try to politicize this issue. And if you're in the midst of it, you truly understand it. Not that we're not trying to figure out a solution that's better than the one we currently have, but again, there is no ultimate or optimal solution, with the exception of what I believe is the Missouri situation, where the state took control of that and said, here's how we're going to do it. That was the optimal solution that I think should have been in place before we opened it up to the masses, and that wasn't thought out. And unfortunately, the rest of us are left with trying to figure out what we can do, and we're hearing, good, bad, and indifferent from so many different areas. So we're trying to work through it. We'll see if we can. We know we have some online options available right now, but again, going into the full situation where people just call in on a list, we're just not there yet because we haven't found just the right solution, but we're still working on that.
Absolutely, Mark.
So, all right, well, again, that's just a quick update what we got going here in Macomb County. We'll try to continue these updates as we can, but in the meantime, we want to remind you to keep you and your family safe.